Testing, check, sound check.
Hello,
Hello?
everyone. How are you?
Good. Hi.
So I hear one issue. We need to make sure that your speakers on your computer are muted. The text is, Jody, the text says it might be yours.
Mine is completely down. I'm just on my phone.
Okay.
I can see you. Yeah. Hi.
Okay.
I can see you in the webcam, but I can't hear anything. So.
You can't hear anything, Megan?
Yeah. So I have to. Should I disconnect the phone and take the call?
No, we all need to be on the phone because that's how it's recorded and that sort of thing. So, yeah, we all have to be on the phone.
Okay.
Okay. Everyone okay now? Yep. I don't hear echo, so I think that I think we're good. So, again, welcome. Thank you all for taking part. A few things. If you've ever participated in market research before, or if this is your first time, you'll hear this spiel and then you'll hear it again if you ever do it again. So I'm just going to really quickly go through it, and if you have questions, feel free to stop me, but otherwise we'll go through it. I have to read a statement. I have to read it verbatim. It's about my responsibility regarding side effect reporting, and so I'll read that, and then we'll get to the heart of our conversation. So first of all, as you guys can see there, my name is Natalie. This is what I do for a living. I work with a company by the name of Narrative Health, and we specifically do healthcare research. And the reason I tell you that is because although our research is sponsored by a pharmaceutical company, I don't work for one. So I don't have a vested interest in what we'll talk about today. My job is to get your honest and candid feedback. We get to pass it along for somebody else to actually do something with. Now, you probably know, but the purpose of our conversation today is really to gain a better understanding when it comes to your experiences living with chronic ITP, and in particular, get your thoughts and experiences as it relates to treatment. So that's our goal today. And during our discussion, we may or may not talk about different products, but please know that this is not promotional in any way. We're not selling any products. It really is purely about trying to learn about your experiences. Also, I think you all know this will take us 90 minutes, and even though there are 5 of us, we all got started on time. Like, we got started right on the nose. So thank you all for doing that. That's often a challenge, but we did it. And so the other thing that's important is just that, there are no right or wrong answers. Also, different people have different opinions, and I want to hear from each one of you. You all represent people like yourself, and so I want to make sure that everyone has an opportunity to talk. So if I ask someone else to answer and not another person, but then I ask you later, just know that I want to hear everyone's input. We just can't all talk at the same time. Often, if you've ever done this before, we normally do this in person. So just like with everything else with COVID, we are, we're making it work. So we'll make this work for sure. The other thing that's important for you to know is that I don't work alone. I work as a team. So I have colleagues that they will be watching. They can see us, but we can't see them. So they'll be watching. Also, we do record the conversation. And so that is for a few reasons, partly for record keeping, so that we can go back and write a report, but also so that others can go back and listen, like, for instance, the market research team or the healthcare professionals that are participating in this research, or my colleagues. So those are all the kinds of people who might go back and listen if they don't actually watch live. You can withdraw from participation at any time or withhold information as you see fit. I also want to make sure you know we said that we would protect your privacy and that this will be confidential. As you can see, we only have your first names on the screen. I'm only going to refer to you by your first name. I'll ask that when you introduce yourself, not say your street address or your doctor's name or anything that can be tied back to you personally, but I do want to get to know you. So I know that's a little, we tend to, when we introduce ourselves, we say, like, hi, I'm so-and-so, and I live wherever, but just refrain from anything that is, specific that can be linked back to you personally. So I'll just make sure, and I'll help you as we go through the conversation to make sure that we do that, because we do want to make sure we do respect and honor what we said as far as your privacy and confidentiality. Now, if you wanted to see a copy of our privacy policy, you can just let me know, and we can send you the link. It's a long link. I'm not going to say it, but if you want the link, you can just let us know. Also, of course, you'll receive an honorarium as a token of appreciation for participating. Now, the thing I mentioned that I have to read verbatim, it reads, different patients sometimes respond in different ways to the same medicine, and some side effects may not be discovered until many people have used the medicine over a period of time. So for this reason, we're required to pass on to our client, who's a pharmaceutical company, details of any side effects or product complaints related to their products that are mentioned during the course of market research. And although what you say will be treated in confidence, should you mention during our discussion of side effects when you or someone you know became ill after taking one of our clients' medicines or had a problem with one of our clients' medicines, I'd be required to report that so they can learn more about the safety of their medicines. And so just like if you're sitting in the exit row, I do need a verbal yes that you are willing to participate. So I have 4 people here. I need to hear 4 yeses.
Yes. Yes.
I'll call. All right. I think I heard 2 at the same time and then the other one. All right. Perfect. Well, thank you all. I'm glad that you stuck around through that long introduction. And so now I'm going to ask you to introduce yourself. The one thing I will say is it's a little bit challenging, so I might just call on you. Normally I just kind of leave it free flow, but if I don't hear somebody say something right away, then I might just actually call on you. So it's not a picking on you. It's just to make our conversation efficient. And so what I will do is call on you guys to introduce yourself just to make sure that everybody gets a chance. And so for my screen, Julie, you're at the top. So I'm going to ask you, if you don't mind, to just tell us a little bit about yourself, what keeps you busy, who's in your household, and what you do for fun. I can't hear you.
Excuse me, my name is Julie, and we retired this past year, and we live in North Carolina mountains, and I like to garden and watch birds.
Sounds good. So I'm still getting an echo. I'm going to ask my tech to help me figure out where it might be coming from. Julie, I think it might be your computer. I don't know if you can take your volume all the way down. Is your volume on your computer all the way down? Now I don't hear you. Okay, so we'll keep going. Now I'm hearing it again. I just want to get this worked out now because we have lots of conversation. And I don't know if anyone else is hearing an echo. Is it just me or just like...
I can too.
Candace, okay, got it. All right. Yeah, I'm asking our technician to please help me because I don't know. I don't know what to do. Okay, he's checking to see where it's from. Okay, what I will do in the meantime, I think he said that it's fixed. So I'm going to ask you, Candace, if you'll go next and introduce yourself. Thank you, Julie. I can't hear you. Can't hear you.
They just unmuted me. I heard them say mute on. They muted all of us, and I'm not muted. So
okay,
yeah,
that's what. Okay.
They may just have to mute and unmute based on who you call on. So hi everyone,
okay.
I'm Candace. I live in Florida, and I am kept busy by my rescue dog Rico, and trying to travel as much as possible given COVID, and trying new restaurants.
All right. Sounds good. Thank you for that. Is it Megan or Mega? How do I say your name?
It's Megha. Can you hear me properly?
Mega? I hear you properly.
Yeah. Yeah, I live in New Jersey, and I'm an architect, and for fun, I like to go to the beach, and I like to take a walk with my family because it's the COVID, everybody's home, so sometimes we go for a walk in the evening.
Good. I think your camera's on pause, which is fine if you want it that way, but I just want to let you know in case you don't know that you're on pause. So, all right, sounds good. And Jody, last but not least.
Can you hear me?
I hear you.
Okay. I'm Jody. I am from the Piedmont of North Carolina, and work keeps me busy. I'm an administrative assistant, and I like to crochet in my spare time.
All right. Sounds good. Anything you've crocheted recently?
Not recently because life has gotten in the way, but I tend to do stuffed animals and blankets and just different stuff.
Sounds good. Sounds good. This is like totally an aside, but when COVID first started, there was like this joke about a grandmother crocheting her grandson a mask, and everybody like joked about the whole idea of like crocheting a mask. I mean, obviously, you know, crocheting a mask is not necessarily going to keep you safe, but she was thinking ahead of everybody else.
That's right.
Every time I hear about crochet, that like I think about that. I was like, crocheting is something that can be great. Well, thank you all for introducing yourselves. I appreciate that. So, of course, as I said at the beginning, you all know that you were invited here because you all experienced chronic ITP, and that's what we're going to be discussing. And so one of the very first things that I want to do is I am going to bring on the screen some images. And so let me just ask, does everyone have a piece of paper handy? Because there will be a few times that I'll ask you to jot something down, and then we'll come back to it in the conversation.
Yeah.
So if you have, perfect. All right. And Julie has hers. Awesome. So here's what we are going to do. I'm going to bring on the screen. There'll be 3 pages of images, and I will try to slowly show them to you just so you get to see all of them. But you're going to choose an image that captures how you feel about living with chronic ITP. I don't want you to think too hard about it. As I show you the images, there's like a letter code, so just jot down. If you want to jot down a few codes, that's fine, but just jot down a letter code of what captures your attention. So I'll give you a few seconds for each page, and then I'll go through and see if everyone has one. If not, I'll go through it again. So that's the process that we'll go through. So here is the first page of images. So again, when you think about how you feel living with ITP, and feel free to just say, hey, Natalie, go back to the other page if you want me to look. Here's the next page. They have a B code. The first one were A codes.
And we're just choosing one from the 3 pages, correct?
You only need one, but if you feel like there might be a couple, you know, feel free to write it down. Just
okay.
I might talk about more than one. Okay. And then lastly, the page with the C codes.
Can you go back to the B page? I'm sorry, it didn't show up on mine. Yep, there we go.
And just for fun, I'll show you A again. All right. Does everyone have at least one image chosen?
Yes.
Okay. Great. All right. I will assume everyone has one. So here's what I'd like to do. I am going to call on you again just because we have this kind of weird thing going on with the speakers that hopefully will get worked out. But I'll call on you so the tech knows if he's muted you to unmute you. So I'm going to start with Julie. Julie, what was the code of the image that you chose? And then tell me a little bit about why.
I wrote down the number, but I forgot why.
Okay, so if you tell me the number, I'll go to the page, and then you can...
B10.
B10. All right, let's go to B10. Okay, so there's B10. Tell me, what did you see in B10, and then maybe it'll come to mind as to why.
The domino effect. It's one thing and then another, another.
How so? Give me an example of what you mean, like one thing and then another, then another.
My condition is completely refractory. For 6 years, I have not responded to any medicine except IVIG. I've tried everything. I don't know what to say.
Okay. All right. B10. And next, I'm going to go with Candace. I don't know what order you guys see people in, but I have you under me, Candace. Go ahead.
So I chose A14, and the reason I did that is because I feel that in a lot of ways, taking control of ITP meant that I was the quarterback of my own football team, and my team being my healthcare providers, and it was extremely important for me to be able to call the plays for my treatment. And the reason that I'm alive today and I'm doing so well is because I was the quarterback of my care team.
Okay. Got it. Anything in particular you want to share about kind of that quarterback role?
So I'd say the biggest thing is managing several different types of doctors. I think the one misconception with ITP is that it's just your hematologist, but I had primary care, I had a rheumatologist, I have a gynecologist, even my dentist. I mean, everybody has to know what's going on, what treatment I'm using, how my platelets are doing. And so it's critical to be able to sort of be that person, because you have to speak beyond the EHR records or the platelet count to the other manifestations of what ITP is in patients, especially for chronically ill ITP patients. So for me, it was all about that. And also just in terms of getting sick, retaining a level of control over my life after ITP took away my independence for a while when I was first diagnosed. It was really important for me to regain some sort of leadership role within myself and my life after being diagnosed, because I was diagnosed at 27 and it totally caught me off guard.
Okay. Mega, how about you?
I choose A2, rainbow pink, because I think my ITP is improving. I first got the diagnosis with the ITP in 2006. It's 15 years, and I have been having a lot of steroids and a lot of other drugs and medicines and intravenous, a lot of things I am going through it. But I see it still, I am improving, so I choose that image.
Okay. All right. Thank you for that. Anything else specific you connect to that picture when it comes to improving?
It's like a rainbow. Like sometimes some days are really better and some days are really awful. You can't get through your day. It's been really hard. You got stressed out. So it's like a rainbow, I think. That's like to me.
Sounds good. And Jody, how about you? Which image did you choose?
I chose B5.
All right. Then go to the B page.
This is
So
the
tell me
deck
what
of
it.
cards.
Mm-hmm.
So I was just diagnosed in December 31st of 2020, and it was by pure luck due to a regular doctor visit, annual visit, and I was scheduled to have some surgery in February, but because of that, and it was major surgery, we had to delay it, and if I hadn't have had that, I apologize for my dogs. My husband and son just got home.
Okay.
And, without that, I may have not known until I was in surgery and something very bad happened. And then on the other side of it, I was put on steroids and then 2 different steroids, and then had Rituxan infusions, and those have seemed to work and have stabilized it, so I was able to have my surgery. So I feel like somehow it was just kind of the luck of the draw for me.
Okay. All right. Well, thank you for sharing that. You know, one thing I'm curious about is really kind of thinking about currently, so not necessarily like today, but like currently in current times, really, what is it like living with ITP for you, kind of briefly? I won't call on anybody. Just feel free to pop in if you have some top of mind thoughts. What is it like currently living with ITP? And I will call on you if nobody talks.
I would just say that I'm much more aware of things. Like before, I was a little more fearless, and now I think through things a little more before I just jump in. Even something as simple as a scratch or something. I'm definitely more aware of things and how it affects me. Medications, just all kinds of stuff like that.
Okay.
For me, it's like in the COVID, I have to be really, really protected myself, like from getting any kind of infection. And this is kind of like I can't go out with other people in social gathering and all that. So it's kind of restricting your life. It's not fun. Since you can't have fun, you have to always in back of your mind see you have ITP, you will get sick at any time. So these are the things ITP can really hurt.
Kind of protective socially.
Yeah.
All right.
Yeah.
Okay. Candace, you want to add anything, or Julie?
I'd say for me, it's the longer I live with ITP, the easier it gets, because eventually my habits and the things like watching out for bruises, watching out for getting sick, I developed these habits, and the habits help me just sort of keep myself as protected as possible.
Mm-hmm. Okay. When you think about, I'm going to say kind of on the day-to-day basis, like how might it impact you?
I'd say as long as I'm not sick and I'm in remission, because right now I am in remission for a second time, it's not too much of a factor. I can think about it at times, like if I get a paper cut or I cut myself shaving, or I get invited to go play like soccer or something, and I have to consider like, oh, well, are my platelets high enough for that? Will that be okay? And that's kind of frustrating at times because it's always going to be there. But it just kind of depends on how I'm feeling that day and what symptoms I'm experiencing.
Anybody else? What, like day-to-day, how is it impacting you?
I think a lot of anxiety. The people who go through it, if they are like something will happen to you, you get cut or anything. So it's bruises and all these symptoms are really, really bad. So you have to watch every day your body. You have to see you don't get any bruises or any cut while cooking or while driving, while you do anything with your kids. So you have to anxious day-to-day life.
Julie, anything to add to that?
With my other autoimmune condition. Just so day to day, it's this juggling of multiple conditions and which ones aren't as well controlled as others at any given time.
Okay, got it. All right, well, thank you, ladies, for that. What I first want to do, we're going to, I use the term journey, and I know sometimes I feel like it's overused, but we are going to talk about this in the sense of kind of your journey when it comes to ITP, up to this point. And a couple things that are important, and that this is really just me to kind of jot it down so that I can keep up with everything. But I'd like to know who is the healthcare provider that you consider to have the main responsibility for managing and treating your ITP. So I'm just, again, this is more of like so I can later connect the dots, but I'm just going to go down the row. Of course, not the name of your provider, but what type of specialist are you seeing? So, Jody, I'm going to start with you.
Hematologist.
Megan, how about you?
I am also seeing hematologist.
Okay, Candace?
Same, hematologist.
And Julie, how about
Hematologist.
you? Okay, so all the same thing. Perfect. So here's our next exercise. We're going to take I have, it's one of my favorite things to look at. It's called an emotion wheel. And so what I'd like you to do is I want you each this time to jot down a word from this emotion wheel that best describes your relationship with your hematologist. So, and it's your relationship with them right now, like at this time. And just do me a favor, just kind of wave your hand when you're done, just so I know that you've got your word and we can keep going. And Megan, your camera is
Okay, I hold on.
I think pause. Do you mind unpausing your camera?
I'm trying, but I couldn't see where should
Let's see. Oh, there you go. Perfect. All right. And Julie, I might have been like focused someplace else. Do you have your word already?
Not yet. No.
Okay. All right. We'll go through the others, and you can still keep looking and find your word. So let's start with Megan. What word did you choose?
if I go to the hematologist, I get peaceful because I know my blood count is stable or not. So if I see him, so I know definitely my blood count is up, and that's most important for me. My platelet count is higher than the required amount. Like if it's above 150,000, then I don't need to worry. And if it's below 4,000, then I need to start the treatment again. So peaceful for me.
But did you say peaceful?
Yeah.
The blue word. Okay, got it. All right. Perfect. And Jody, what word did you pick?
And this was from anywhere on the wheel, correct?
Yes. Yes.
Okay. I would say responsive because, he's very good at explaining things to me. And when I have questions concerning, what are your thoughts about this treatment, or, how would this affect my other autoimmune disorders, that kind of thing. He takes the time to explain it and just really, like I said, takes the time and make sure you understand everything completely.
Okay. Hey, Candace?
I chose valuable because we have a really great relationship, and I went to him after my original hematologist unfortunately had retired, and that was those were tough shoes to fill because he was an expert in the condition. So going from that to somebody who was my age was kind of crazy, but it was also great because I knew that he wasn't going to retire anytime soon. But we became a team, and that was where the value was, because he recognized that I needed the treatment that I use Rituxan, and I've used it twice, and it was successful, and my insurance company was giving me a lot of grief about trying to approve it and cover it. And we worked hand in hand, and we go through the research, we go through new clinical trials that come out, we look at studies, we look at data. He's been super valuable during COVID to discuss, I can't have vaccines, so that was a big challenge, and we discussed the Regeneron monoclonal treatment, and he stays up on stuff for me. He doesn't have a lot of ITP patients, but it's that value of, even though he doesn't have many people like me, he cares to go the extra mile to answer my questions and make sure I feel secure.
Okay. Good. Julie, did you find a word yet?
And this is a word to describe our doctor and patient relationship, is that what you said?
Your hematologist, yep. How, basically a word that describes your relationship with your hematologist.
He's responsive.
Okay. And, you know, like Jody mentioned responsive. What's your rationale for responsive?
Responsive means that when I leave a message, they actually call back. I don't have to call sometimes and track them down. They've been responsive through thick and thin, through COVID, non-COVID, you know, COVID rise again, you know, whatever nonsense. That's why.
Sounds good. So, Jody, I'm going to pick on you because you mentioned something that I'd love to learn more. I'd like to learn more about, just kind of in general. But I'm going to use you as kind of the I'm going to say
the guinea pig.
Yeah. What I'm going to ask you, because you said that your doctor explains things well, and what I'd like to understand a bit about is kind of what a typical visit or consultation is like with your hematologist. So when you're going in, you know, specifically regarding your ITP, what's a typical consultation like? So I'd like to hear from you what it's like, and then the rest of you, I'd like you to tell me how yours may be similar or different.
So, you know, first of all, you go in, you get your labs done, and then when you go in to meet with them, you know, they pull it up and compare to see how your levels are. One of the things that I would say about my hematologist is, you know, I'm one of those people that I had looked into things as soon as I found out that was a concern, and so I've researched ahead of time. So I had a lot of questions about, well, you know, what about lymphocytes or leukocytes or, you know, all these different things, and you know, he was able to tell me which ones that I needed to really pay attention to and be concerned with. And, you know, also in the beginning, you know, he looked into possibly one of my medications could possibly have been the cause of ITP. So there was research on that. He had already looked into that, went through everything, which determined that that was not the case. But just really breaks down things, answers any questions that I have, any concerns, you know, as far as with the vaccine, asking questions about that. Just wanting to know how I'm doing, and, you know, if there's anything that we need to focus on to check my levels sooner.
How frequently do you have a consultation with your hematologist?
Right now, because mine was doing very well, I'm on every 6 months. They did check my labs before I had surgery in June, and then he had me do a follow-up a week after to make sure that my levels were still good due to the surgery. But he's considered mine to be in remission right now. So.
Okay. Great. And how would you say, you know, how do you feel when you walk away from that consultation?
I would feel positive. You know, feel like I have someone on my side that's willing to go to bat for me. You know, they communicate well with my other healthcare providers. I have several due to several autoimmune conditions. So I really just have an overall comforting feeling that no matter what it is, they're going to do everything they can to help me get through it.
Thank you for being our spokesperson. So the rest of you, I'd love to hear how yours is similar or different, but it's also kind of how you feel at the end of, you know, your consultation. I will call on you if you don't speak up.
You repeat the question?
Yeah, I'd like to know how similar or different is your experience when it comes to when you go see your hematologist as compared to what Jody kind of went through.
My appointments are every other week, every other month, and I get a IVIG infusion every month, and about every 6 months he tells me about yet another new medicine. Do I want to try it? We discuss whether or not, and then I either start trying it and then, go back to just maintenance IVIG. I've never been in remission, so I don't know what that's like yet.
And how do you feel when you leave your consultation? Like, what's the feeling that you have? And maybe it's not the same all the time, but just kind of what would you say?
My doctor's kind of dismissive in some ways. If I mention other symptoms or kind of dismisses things, or if I say, well, if I'm always refractory, what happens then? And that's where it really just shuts me down. We'll find something for you, honey. We'll find something.
And how does that make you feel?
Pushed down, like they're just saying something they were taught to say. I don't know. It doesn't sound real to me.
Got it. Understood.
Yeah.
Candace or Mega, anything you want to add to your experience when you're actually visiting your hematologist?
When I visit my hematologist, I usually visit in 6 months or so. So whenever I left his office, I feel confident and like a lot of pressure is left off from my chest, because I feel really I am in good hand, that somebody will take care of me. I got that feeling whenever I went to his office, because he listened to my concern, and I thought I was the youngest person who got all of this ITP issues and all that, but he told me that there are a lot of younger people like me, so it's like boosting my confidence. Like I'm not the only one who had this one ITP issues.
Good. Candace, how about you?
So when I'm sick, I go normally to the hematologist once a week. They draw blood at the beginning. I sit in the waiting room for about 10 minutes, and then they call me back and do the vitals. And by the time the doctor walks in, my CBC is there, so they know my platelet count. That it wasn't always like that. When I first got sick and went to a different doctor, they would just give me the orders to go to a lab. So we would meet and talk. Sometimes I would have the labs ahead of time. Other times I would have to do it later. I would still do it weekly, like in terms of the CBC. But now it's telemedicine because of COVID, and I haven't had a platelet count in a long time, but I know my disease. I've lived with this now long enough that I know what the symptoms are of when the platelets start to drop. So I would be able to just call his office and say, hey, I need a prescription for a CBC, and then just go get it, and then we can talk about next steps.
Any other, I'm going to say, feelings that you have, like when you've left your consultation?
I normally feel like I have a plan. That's the one big thing, is that I had a doctor in between my one that retired and this one now, who was nothing short of just an arrogant jerk, and didn't want to give me my treatment, didn't want to listen to me, didn't care what I had to say. And so I left him feeling frustrated, and just completely like I was floating through with no plan on how to control the disease. But when I leave the doctor now, like I just feel like I have a plan, we have things set, and then if anything comes up, he just tells me to call him.
Got it. All right. And we're going to do another kind of roundabout just to kind of check mark on which treatments. I know that Julie talked about you have an infusion, did you say every 2 weeks or once a month?
Once a month IVIG.
Okay. And Candace, what are you on anything right now?
I am not. I've had several treatments, but the one that puts me in remission is Rituxan, or rituximab.
Okay. All right. And Megan, how about you?
For last 1 year, I didn't get any symptoms, anything, so I am good. So I think last time I went to the doctor is about more than 6 months ago, and I don't take any medicine now.
You don't take anything now. How long ago was it that was it 6 months ago you said that you did take medicine or not?
Yeah.
And what was
no,
it?
I didn't.
6 months.
My count was okay. So I just went to make sure I am okay, to check my blood count and platelet count.
Okay. And what was the last treatment that you were on, and when was it?
I think it's 2019, January 2019, and it was some steroids. I think I went through so many treatments, so I don't
remember them all?
remember the name. Yeah.
Okay. Were you ever on Rituxan or rituximab?
Dexamethasone.
Yeah,
It's
yeah.
dexamethasone. It's a steroid. Yep,
Yeah.
I had
Okay.
that too. Yeah, it's a mouthful.
Yeah, it is. And Jody, what medication are you on or were you on?
I'm not on any medications now. In the very beginning, I took dexamethasone and then was on a combination of Rituxan and prednisone at the same time.
Okay. Makes sense. All right. Sounds good. Here's what we're going to be talking specifically about treatment. And so I know that it's been a while, specifically for you, Megan. Candace, how long ago was it that you were on Rituximab?
Last infusion was 2 years ago.
2 years ago. And Jody, how long ago for you was it?
Mine was this year. I had them January, end of January, February.
Okay, because you just got diagnosed, I think you said, about 6 months ago, right?
I'm a newbie.
You're a newbie, yeah. Cool. The reason why I was asking that question is because we're going to talk about treatment, and we're going to talk about it kind of in detail, like the process, to go on treatment. So part of it is because I want to know, can you remember it or not? So I'm going to hopefully, you'll remember it. If you can't, don't worry. I won't call on you, or you don't have to. I won't force you to speak. But here's what I do want to do. We're going to so what I am curious about is just for the last treatment that you were on, kind of what led to that treatment choice?
I can start. I actually started at my rheumatologist because I started having like joint pain issues. So I started with her. She did a bunch of blood panels, including a CBC, and my platelets came back at 129,000. So that was kind of the warning sign that my platelets had always been above 200, that ITP was back, and I probably was experiencing that first tinge of the platelets going down. So went to that horrible hematologist, and he put me on prednisone. So I was stuck on 60 milligrams of prednisone, and I asked him about Rituxan because I had used it once in 2014 and had made it to 2019 in remission, and he told me no. So I was like, okay, time to find a new doctor. Went to the new doctor. He wanted to try IVIG first, and he said that he felt like it may kick me back into remission. He had seen that before because he was a resident under my first hematologist and studied at the same medical center. So he was very knowledgeable and said, I saw him do it, let's just try. Unfortunately, didn't work because this was a couple months later. It was March to June. I did not do well with IVIG. It didn't even last 2 weeks. So then I went on dexamethasone, and that was just to boost my platelets up while we went through the paperwork for Rituxan, because I pretty much begged him, like, please let me have my life back so I'm not in your office every week. And then I finally got Rituxan. It just took a long time to get the insurance company that I had didn't even have my ICD-10 code for ITP in the system. So I had to get them to add the ICD-10 code, and then the approval process through the insurance company, they were sending Rituxan to a cardiology group, the third-party group and I was able to yell enough at somebody on the phone to get them to explain to me where it should go. And then I had the nurse from the insurance company call me, and I explained, I've done this before. Doctor's willing to talk to you. I'll talk to you. And we got it. But it took several phone calls to make that happen. And in that period of time between a 4-day treatment of dexamethasone and my Rituxan infusion was about 2 weeks. And there was no treatment in between that time.
going to ask a question, but I'll come back and ask another question. Anyone else? Help me understand what led to that treatment. I know for you, Julie, you said that that's kind of the only thing that's worked for you. You've tried other things, but that's
Right.
IVIG is the only thing that's worked.
Right.
When is the last time you had a conversation about changing treatment?
The last time was going back on Rituxan again, which has never done anything for this condition at all for some reason. They asked me last time to consider end plate. So it's, I think, the one other thing that might be appropriate. I don't want to get my body part removed. I get my that the only other choice. Yeah, sorry, running a blank.
No, were you saying your spleen? You didn't want to have that removed?
Yeah.
Is that what you're talking about? Yeah.
I have a different condition, and it was another body part, and it just got stuck in my head, and I couldn't think of the other one.
That's okay. I got you. All right. Sounds good. Either Jody or Mega, just kind of what led to your last treatment? Like what was happening? Anything that kind of led to the reason you went on that treatment?
I was diagnosed in 2006, and I have a baby at that time. So they started me on prednisone for, I think it was 40 mg or something. But that medicine makes me so thirsty, and I gain a lot of weight, and I think I am having a lot of side effects of steroids at that time. So after 3 months of treatment, and second time I had to go through that IVIG treatment, like they put the platelets through the blood, something like that, and then they tried to switch me on niacin. I still don't remember the exact name, but lot of medicine has a lot of side effects on your body, and I'm going through it. And this medicine, dexamethasone, it has like a joint pain and muscle cramp, and already your body is like in fatigue, and that's why they stopped me taking that medicine. So I am still searching on the internet what is the best option for me, and I'm going to talk to my hematologist again. If I get, if my platelet count again go below the required amount.
Okay. All right. And Jody, how about you? Tell me about kind of what led to the last treatment that you were on. What was going on?
So they first put me on dexamethasone, the 4-day pulse, and was in severe pain. I felt like somebody took a sledgehammer to my ankles because it was, the pain from the medication. It was just so strong. And so once we finished that, my levels did go up a little bit, but then they just weren't up enough. And so we started doing a prednisone taper. I think I started out at 100 milligrams, and I was on that about 10 days, 100 milligrams a day, and then we slowly tapered down to 10 milligrams a day, or 10 milligrams a day. We tapered each week, went down 10 milligrams, so several weeks. And while I was doing that, I was also getting the Rituxan infusions, and getting things checked, and that the combination of the prednisone and the Rituxan just kind of worked.
How long did you do that for?
Let's see. Well, I had 4 infusions of Rituxan, and I was on prednisone for probably maybe 7 or 8 weeks.
Okay. All right. Perfect. I am going to bring back our wonderful emotion wheel. And I'd like each one of you to choose a word that describes how you felt when you first talked about whatever your last treatment was. It sounds like some of you have gone through it more than one time, but a word that connects back to how you felt about when your treatment was discussed for the first time. And again, just wave your hand. Let me know you have your word. Go from there.
This is how we felt at the first.
The first time you discussed your last treatment. So whatever the last treatment was that you discussed, I know that, again.
Right. So I would have to say I was skeptical. And,
okay.
So I know we're going to talk about Nplate again, and I'm looking for another word here now, more amused but interested in hearing what they have to say, because I've researched and it has had a good reaction in a lot of people, and why not this?
Okay, but there's kind of that, I forget, there's a word for it, but
skepticism.
That,
it's
cautious optimism, is that
yeah.
Skeptical, amused, but interested. Okay, got
it. Yeah, a little combination of those little ones floating around there, but yes, that's exactly.
Okay, all right, perfect. Candace, how about you? I think you had your word.
I was excited because I knew that relief was coming.
And that's because, tell me a little bit more. So when you say excited because you knew relief was coming, what is that? Part of it, I think, is because you've experienced it before, if I understand correctly. So if you can think back to the first time you actually you discussed rituximab, not this time, but the first time, how was that feeling?
So for that one, I would say I was a little bit more anxious because it's off-label, and this was back in 2015, so there wasn't as much research as there is now, because I'm one of those people screaming from the rooftops about how important it is to understand clinical diversity in ITP and that different patients will react to different treatments, and actually, and some will be successful and some won't. But I spent a lot of time researching that drug and the mechanism of action behind it. My doctor encouraged me to do it. He gave me some information and places to go look. And then I went and spoke to patients and got some advice, looked at, how they reacted to steroids, and then what did they do after, and did it work or didn't it work, and what other conditions do they have besides ITP. And so it went from anxious to sort of hopeful, and that was sort of the transition of once I started to speak to other people who had the treatment and were successful, and I identified some similarities in their patient journey to mine. Then I started to realize that was the best option for me.
Good. Anyone else want to offer up their words? I don't know why the screen just changed. I didn't change it. There we go. Okay.
I would say that I was both. I would say that I was both anxious and scared, because you hear, with Rituxan, and you're in there and you're getting these infusions, and you look at the whatever your appointment is, and it says you're getting chemotherapy, and you're like, wait, did somebody forget to tell me something? That was very scary, and looking back, it shouldn't have surprised me, because I have another disease that I was on a chemotherapy drug for many, many years, but it was just really scary.
All right. Megan, did you want to share one? You don't have to, but if you have one, want to make sure.
I will go with the aware thing, because I know a lot of ITP drugs has a lot of side effects on your body. So I am prepared that this drug might have some side effect, and doctor already discussed with me, but that's the word I can go with, aware.
Okay. All right. Sounds good. So I'm curious, as I said, I'm kind of piecing this together as a journey. So again, if we go back to the last medication that you were on, I am curious to know kind of what were the next steps from that discussion to you actually starting the therapy. I know, Candace, you talked about some insurance hurdles, so I don't know how much time it took, but between the time of saying, okay, yes, this is what I'm going on, to actually starting it, what were the steps between there?
So for me, it was, I was just saying, it was like scheduling at the hospital infusion clinic. So we had to go through that. And then the doctor wanted a week to do the prior authorization. And that and really where the doctor told me the weight lies is with the prior auth. So because it's off-label, there was no prior auth help. Like he explained to me that on-label drugs like Nplate, Promacta, Tavalisse, and everything have the systems available where they just send it into the hub and then the people take care of it and they don't have to worry about it. But for something like Rituxan, he had to go through the insurance company directly. So it took a total of 2 weeks before I could even get the infusion just because of all of the paperwork.
And was there anyone else involved in, I'm going to say, kind of the decision-making process for you?
It was just between he and I, which I was fortunate about. But he had said one of the reasons why everybody was okay with it in terms of like the hospital and he works in a hospital was that my former hematologist had left such good notes and he studied under him that he had seen it himself. So it wasn't hard to convince him otherwise. But that if it was the first time, it would have taken a little bit more because it's just not something they normally see, and because there are other FDA-approved drugs, they may have wanted to try something else.
Got it. Jody, how about you? Any kind of what happened in between the time of you saying, yes, I'm going to do this drug, and then actually starting it?
So when I went back after the dexamethasone, and he mentioned starting the prednisone and doing the Rituxan infusion, he actually had me scheduled the very next day to get infusion. However, again, insurance issues and just back and forth, and I had to make some phone calls, and it was a nightmare. Granted, it was nowhere near the 2-week nightmare, but it was just, you just found out you have this disease, and then you're going through all this, and the insurance is just a nightmare, and you just want to cry. But that was on. So I went on a Thursday. I was supposed to have my first treatment on a Friday, and they did not get it approved until like late Friday, I think. And so I was able to go the following Monday and have my first treatment. So it was very quick, and I was very fortunate.
Was there anyone else involved in kind of I'm going to call it the decision-making process for you?
No, just me and the hematologist.
Okay. All right, perfect. We are going to do another exercise. Again, this is really just going deeper and deeper into the conversations that you've had around treatment. And so this is my lovely, I call it a bubble diagram. Basically, what you see here on the screen. So again, I want to make sure everybody has pen and paper. You're going to jot down kind of your own notes. But what I'm looking forward to is if you can kind of go think back to the conversation that you had with your doctor, kind of, I'm going to say, at that deciding point of accepting the last treatment that you had. If you can think back to that point, I want you to, there's one side is you, the other chair, as you can see, is your doctor or your hematologist. And the top bubble that's not squiggly is what was actually said. The bottom bubble is what was being, what you felt or were thinking that was not actually said. And so I want to give you guys a couple minutes to actually think about that. So if you go back to the last consultation you had where there was actually a decision made to start your treatment, whatever your last treatment was, what was stated by both you as well as the doctor, and then what were you thinking and feeling and not saying, and same thing, what do you think the doctor was thinking and feeling but maybe not saying? And I will give you time to jot those notes down. Just say I'm done when you're done, in case I'm not looking at the screen.
I'm done.
Okay.
I have mine.
Okay, I've got mine.
We're just waiting on Megan.
Okay, I'm done too.
Perfect. So here's what I'm going to ask. I won't ask everyone to go through this, but I would like you to, I'd like 2 volunteers to talk through theirs. So who would like to volunteer? Being quiet. Candace, thank you.
Okay.
One more. And Megan. Okay, perfect.
Okay, okay.
All right. So, Megan, you want to go through yours first?
Yeah. Every time I go to the consultation, I ask the doctor how long I have to take this drug and what are the side effects. So this is me. And then doctor explaining the side effects and the duration and the doses and how I should take the drug with the meal or without the meal, or which thing should I not miss. Some of the drugs has like a milk allergy, or something drugs should not take with some other food, so like fish or something. So he explains me everything. So that's the doctor nurse.
And what were you feeling? So I know you're asking because you're a little bit anxious about side effects. What are you feeling during this conversation?
I feel confident because I will get all the answers. So,
okay, so you just want your answers instead of
yeah.
Anything that you were thinking but you didn't actually say?
I am having this issue like more than 15 years, so it's like a routine for me. Go to the hematologist and like if I have any question, I can ask him over the phone too. So
okay, so there's nothing that is left unsaid, is what you're
yeah,
communicating. Is that right? Okay.
I am used to it. So.
And your hematologist, is this, I know you said you've had your condition for 15 years. Is this the doctor that you've had for a long time as well, or
Yes.
New doctor?
Yeah, same doctor. Same doctor.
Same doctor. Okay. So what do you think is going through the doctor's mind? You know, what do you think the doctor's thinking and feeling that it's not being stated?
My doctor is always very reassuring that I will feel better soon. I don't have to take this drug so long, and my count will go up in like few months or so. So I feel quite reassured there. So
okay. All right. Candace, you're up.
So I said to my doctor, I want my treatment that works, and I want to do it as soon as possible. And his exact response to me was he slapped the table and said, let's do it. So in the back of my mind, what I didn't say was I can't take any more experiments with other treatments because I had a bad reaction to IVIG and didn't want to deal with it. And I'm sure that what he didn't say was, I really hope insurance will approve this because I don't know if I can take it much longer.
Got it. Anything else that was part of that discussion?
We had a brief discussion about the pre-medications for the infusion, just from experience and knowing that I need certain things. And then other than that, it was just sort of the planning of, okay, well, if they deny it, what do we do? Who's going to take the lead first on getting it? And so he told me, like, he'll take it, and then if there's an issue, he'll let me know so that I can step up. And then that's what ended up happening. So we worked in tandem to get everything settled. Okay.
And for either one of you, were other treatments discussed? Like, or I shouldn't say, I say discussed, but like, were there any comparative, was there any comparative conversation to other things that you could have taken or that were on the table?
We went through every single one. Like,
tell me what
just
that
pretty much like a checklist of, we had, obviously I had already been on prednisone and dexamethasone, so steroids were there. We ruled out splenectomy right off the bat because my former hematologist had always said, absolutely not. The spleen doesn't solve, taking the spleen doesn't solve the problem in ITP, and in his 40 years, he never saw a patient achieve long-term remission doing it. So my doctor now took that during his residency and was like, I won't do that either. We looked at Nplate, Promacta, Doptelet, Tavalisse, even Cellcept off-label because some of those anti-rejection medications are also used. And then we discussed Rituxan. So it was just one of those things, like kind of just going through the list of like, here's all the stuff that's available, but you do so well with this. So if for some reason it doesn't work, we'll come back to this list and revisit it again.
Okay. So it's more like, here are the options, not necessarily here's why I think this or that compared to this one. It was just like, there's all these things. This one seems to work. We're going to go with that. Did I capture that correctly?
Yes, because it was because of my insistence of, and I came to him not just like knowing like I want this, it's also the science behind it. I know exactly, like, Rituxan attacks the mature B cells and shuts them down, and my condition is completely driven by B cell dysfunction. So it was like, we pretty much were like, unless there's a drug that comes on the market that addresses that B cell dysfunction similar to Rituxan, this is going to be the go-to medication every time ITP flares back up until it's not effective anymore.
Got it. Jody or Julie, you want to add anything? I know obviously you guys did this exercise, but anything you want to add, anything that is like completely wildly different from your experiences? Nope. Okay. All right. Sounds good. We are going to go to my images again. This time you're going to choose an image that reflects how you feel about your, I'm going to say, most recent medication, because none of you are actually on anything except for Julie's doing the IVIG. All right. So same thing. I'll show each ABC page. If whatever jumps out at you, grab your code. If you want me to go back, just shout, hey, Natalie, go back. And
what the question again is?
This is choosing an image that reflects how you feel about your current treatment or your most recent treatment. Okay, there's the A page. Here's B. Here's the C page. Want me to go back?
Yes, that'd be great. If you could go back to A for a second.
Did everyone have their letter code? All right. Jody, I'm going to pick on you to go first again. Which one did you choose for your treatment?
I chose A2, which is the rainbow, just because, you know, it was very dark and scary getting diagnosed, and again, very new, not compared to the other ladies, but, you know, at least it gave me some hope. The rainbow made me think of the hope that the treatment gave me.
Okay. All right, perfect. And help me understand, so how did it give you hope? Like, what was it about what you learned or heard, or like what gave you hope?
Researching it, you know, joining support groups and learning about other people's experiences, you know, the
it just, there were a lot of people that had taken it that were able to be in remission. So that kind of gave me hope.
Okay. You brought up something that I actually meant to ask before, support. Where or who else do you get support from besides your hematologist?
All of my medical providers are on board, and they're very diligent in asking me how things are going, and I try to keep them up to date. Like when I was getting the treatment, I would let them know the status and everything. And then also, I found an online support group that, has people from all over the world talking about their different experiences, and, just being able to talk to people that live through it daily.
Got it. And Jody, on a scale of 1 to 10, I want to know how satisfied you were with your treatment, so your last treatment. So 1's not at all satisfied, 10's extremely satisfied. What would you say?
Oh, a 10.
Okay. All right, perfect. So Jody is an example of what we're going to go through. I do need to go through this with everybody. So Megan, how about you? Which letter code?
I also A2.
Okay, I know that was your last one.
Yeah. I still have the hope that I will get cured one day perfectly, that I don't need to take any drugs anymore. And this is like rainbow. It's like hopeful, right? So A2 is.
Okay. Scale of 1 to 10, how satisfied were you with your treatment?
I think I go with 8 because there are a lot of side effects also. So I will go with the 8 number.
Okay. All right. What could be better? What could take it to a 10?
I don't want the drug should have any other side effect because you're already going through a lot of bruises, and every time they draw the blood, there is a lot of black spot. Your skin bruised so easily. So it's not possible. I am asking, but I don't want any other side effects.
Fair enough. Julie, how about you? So for your IVIG, what's your what image did you choose?
The A17, another brick
Okay.
in the wall.
All right. And tell me, that means what?
Well, I keep trying to find closure, so I just, at this point, I other than this trying one more medicine, I'm hoping that this will just stay with what I'm with until it doesn't work anymore. I mean, they keep saying it's not going to work soon. Well, how many years already? So when, but I like a brick in a wall, like kind of completion, or like we've tried everything.
Okay. Sounds good. And again, thinking about on a scale of 1 to 10, how satisfied are you with it?
Well, it's not that I'm not dissatisfied because my doctors haven't found the right treatment. After all, they've gone out of their way to get me onto different trials and to at least get me exposed to other possibilities. And I always feel like they're listening to me, and they know that I'm more frustrating than maybe another patient. That's all.
So your number. So I want to know your satisfaction with the actual treatment. So 1 is not at all satisfied, 10 is completely satisfied. What would you say?
At a number 10, at a 10, it's still refractory, but at least I have 30 days to go play face punches or something. I'm kidding, but
Right, yeah. Yeah.
Sorry. But I mean, my platelets will go pretty high for a week, and they'll be like, yay, 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 and then, but I get, so it's somewhere between a 9 and a 10. I'm satisfied here, but the doctors seem to want to keep trying something else. And
got it. And Candace, did you choose? I didn't catch.
I chose A11, and for me it's because my treatment gives me the tools I need to live a more normal life, or as normal as it could be with a chronic ITP diagnosis. And I'd say like my satisfaction is a 10 because I am able to live a pretty normal life. And I know how fortunate I am for that because most patients don't find that treatment or don't have that treatment yet.
And as far as support, have you, like, where else have you gotten support from besides your hematologist?
So for me, the first place I ever turned when I was hospitalized and diagnosed was social media, just Facebook. I started looking to see if there was a Facebook group, and I found several. And then I started a blog, and the blog started bringing people to me to talk about ITP, and then I just utilized the internet as much as possible because it's hard to meet people with your condition just in and around because it is a rare disease. So even though my doctor has maybe a handful of people, we're not all in the office at the same time. So I've met a few people with my condition just in talking about having it, and they're like, I actually have that too, because unless you see the bruises, and I think we could all say we try to cover those up as much as possible, you wouldn't know by looking at somebody that they have ITP.
Right. Yeah, it makes perfect sense. Sounds good. When you guys think about your treatment, help me understand, I guess, what have been the most challenging aspects of it, and then like what's been, I'm going to say, kind of the main advantage, so to speak. And when I say, I'm going to say aside from insurance, because I know given that, you know, label and you got all that kind of stuff to go along with it. But aside from that, what challenges do you feel like are the main challenges, and then what are the kind of main advantages? And just jump right in. I don't want to pick on anybody again.
I'd say some of the challenges associated with the financial cost of it, because it's an infusion product, you got to pay for sitting in the infusion chair, you got to pay for the drug, and it normally maxes out your out-of-pocket maximum for insurance. The other challenge is explaining it to other people, because first time around, my family was like, you're going to do what with a chemo drug? And Jody may have also had that experience too when you're trying to explain to people, like, you're experimenting on yourself? Are you nuts? And then the second time around when I was fighting to get the drug, it was like my own mother even said to me, like, well, you're not a doctor. Why don't you just listen to him? And I'm like, because I'm telling you I'm suffering. So maybe listen when I'm telling you that it's not worth it to me to stay on steroids. Like when Megha talks about the side effects, I can say with like no qualms about it. Like being on high doses of prednisone made me suicidal when I was diagnosed, and I refuse to be put on them for long-term like treatment because it was so bad and the side effects were so bad. And so for me, it's like that's, you know, explaining to people this sense of urgency I have for the treatment is difficult, and there's really nowhere for me to turn to help them understand why I'm advocating so hard for access.
Got it. Just while I'm talking to you, Candace, has there ever been a time where you had questions that you wish you asked but you didn't?
Oh, yes, all the time. I think one of those things, like, I'm very fortunate that my doctor, one of my best friends and his wife grew up together, so I can email him, and he's totally cool about, like, asking questions, because it's one of those things where I learned very early on to bring a notepad with me with questions before my visit, especially when my platelets are low. I get brain fog, and I forget, and I'm just not good, like, mentally, and I'm not sharp, so I'll forget things. So I have to have a pad with me. And I don't really like to go to the doctor with other people, even though sometimes people offer. I prefer to go by myself because people want to chime in, and, like, no offense to anybody, but until you walk this path with ITP, like, people can say what they want, but their opinions are kind of meaningless. But I'd say, like, that's kind of the thing. And so it's really important for patients to be able to have that open line of communication, that after you leave the doctor's office, you have somebody, a nurse, a front desk staff, an assistant, or the doctor to be able to contact her or use the EHR system or something, because questions always pop up.
Jody, I saw you nodding on a couple things. Jump in, tell me what
Oh,
your
I
thoughts
absolutely believe, I agree with everything that Candace just said. Definitely, and again, there I go with my brain fog. I apologize. refresh my memory. She was
Yeah,
saying.
she was talking about.
What did
Go
you
ahead.
say?
The support.
I can. We talked about support, but Candace was talking about. Well, one of the things I asked was like, was there a time that you had questions that you didn't ask, that you wish you would have asked?
Yes.
She was just saying yes.
And I definitely. Yeah, I message my doctor when I have questions. I'm like her. I have a notebook that I'm getting ready for an appointment with a different doctor tomorrow morning. That I always take my notebook. I write down my questions before I go. I agree with going by yourself. Like you said, until you've walked in someone's shoes, you have no idea what it's like. Definitely, it's definitely been good to be able to reach out and get the questions answered.
Got it. I'm curious about, you all have you chose very positive pictures for your treatment. I am curious, like, what would you say is use the word the main benefit, other than it doing its job, but like, other than that, like, what would you say is the main benefit of that treatment? I know Candace, you talked about the mechanism for, I'm sorry, Jody, I just wanted to point this out and then I'll come back. So just the mechanism of action.
No, you're fine.
That specific mechanism for rituximab is important to you. Go ahead, Jody.
No, I was just going to say, I felt like the Rituxan worked a lot faster, maybe than some other treatments as well as being combined with some steroids. So I would say that, definitely the efficiency or, the quickness in my body responding to it.
Megan, any thoughts about just your treatment and what you felt like was an advantage?
Yeah, the drug works really well, and my count goes up really quickly. So that's the positive thing about the treatment. You want your count to go up. You see the count, you see the numbers, so the number goes up. So that's the positive thing about that drug.
Okay, yeah, so it's like you can actually see that it's working. Like you have a tangible, your lab value tells you that it's actually working. That's a good point. I appreciate you bringing up that point. All right, I know I only have 8 more minutes with you guys. I don't know if you realize that we've been on here for almost an hour and a half. Do I have that right? Yeah. So I got 8 more minutes. The last thing, what I want to talk about really, say kind of last, is I want to really, as fully as I can, understand more about what you feel like you need when you go, when you've gone on your treatment. So, or like for you, Julie, just kind of, what support do you feel like you most need? And so to help us with that, I am going to have a little guess right here. So, what have been the moments that you felt like you most needed support? And I'm going to try to type it in. It's going to be wonky just so you guys know, but it's just to keep us, so we all know that what we're talking about. So moments when you were most in need, just shout out. Go ahead, and if I see your head nodding, that's going to mean to me you got something to say. So Candace, I'm going to start with you.
So the first moment, diagnosis. That's I'd say when you're diagnosed, you need support, and then also when you come out of remission, it's like being diagnosed all over again. Both of those are definitely times you need support.
All right. Anyone
I
else?
would say when you first start your treatment, you need the support and encouragement, I guess, but you've made a good decision, kind of thing.
Ah, okay.
Yeah. Yeah, I think diagnosis, at the first time you don't know anything and it happened to you, you need a support. You need somebody tell you, you will be okay. You need that kind of, because nobody knows what is this and why it happened to you. Nobody has the definite cure or anything. So I think diagnosis is the at that time you need support.
Okay.
I'd say
When,
other major life events or medical events, like I ask my doctor all the time about, well, pregnancy and childbearing as a woman with ITP. What does that mean for me? What do I do? What's the game plan? How do we address it? How do we tackle it? I'd say, just going through your menstrual cycle to, just women's health in general too. There's not a lot of information or support, and the doctors do kind of just look at you like, well, we hope there's some research coming out soon that may tell us something. So, and that's frustrating because those are questions that everybody's so focused on platelet counts and the side effects of medications and things. It's also like, well, we're also like people. We work, we live. I'd also say changing insurance. That's another big thing. It's just I got a new job this year and changed insurance, and I had to like think about things like, oh, co-pays, are my doctors in network? Are the treatments covered?
okay. All right.
And I would
Anything
say
else?
when you're doing treatment, support while you're doing the treatment, as far as just for an example, when I had mine, I would come home and I would just take the whole day off. Be able to have that flexibility with work. And they knew there may be a day or two where I was down and out, just wiped out, but just having that support in your job, in, anything you do.
Okay. Julie.
Hi. So I kept wanting to insert this comment just in general, but when I am in need of support, I have found that one of the organizations, I've not heard anyone mention the different platelet organizations, so I'm particularly happy about the support I've received from the PDSA, the Platelet Disease Support Association. My son also has ITP. He's gotten 2 scholarships from them. They have helped countless times accessing materials and things that have given me hope, because oftentimes there's really not anything a doctor can magically say, and I get it. I'm frustrated in general. Times when I'm mostly needing support are each time a treatment, I fail a treatment is a moment when I'm very much in need of support, or when I'm having significant symptoms and my doctors are playing, is it a blue, green, or red? Which autoimmune disease should we put on the yeah. So that's constant,
All right, you guys have given me a great list here. That last word, that thing that I forget, I spelled wrong there.
I like that.
We'll
Waving.
But waving symptoms. It's supposed to be when having symptoms. So here's what we're going to, the thing that we'll do to wrap up. First of all, I didn't even expect that you guys would give me so much. So thank you so much for, kind of telling me those moments, when you're in need of support. The last thing we're going to do is what I'm going to call a wish list. And so unfortunately, we can't look at these side by side. What I'm going to do is we're going to go to the wish list, but we want to connect them back to these moments of support. And I think you guys all know what you said. And if I forget something, help me remember. But so considering these moments when you've most needed support, I would like to know if we came up with, what your wish list would look like. Like ideally, what support would you want, along the journey? What would that actually look like?
access to materials appropriate for patients and doctors. I'm the one that always clicks on the, for doctors, press this button. I go right there. I don't bother with the dumbing it down for the patient, but I sometimes will read it what I miss. But I want to see access to documents. I don't have access to medical journals, and sometimes the online things I can only read an abstract. So I want access to all the recent research. I found that through some of the platelets, that organization, and also just getting on different lists. That's one thing. I wish that everything had been. I wish I had a person that worked with me. So, for example, I have another autoimmune condition called MS. So we have a group, MS Friends, and I have MG. We have a group for MG Friends where you're teamed with someone that's more experienced. So in some cases, I'm the one more experienced in a different condition, and I have someone who I can kind of ask questions, not medical questions, but just clear support that isn't my family member fumbling for how to say, I'm sorry you're hurting, I'm sorry you're frustrated. Trying to be very helpful. I get it, 100%. But a lot of times I'd rather speak to someone who's also doing it themselves. I was not presented by any of these, like the organizations or joining various materials, access to materials. No, my doctor never, ever, ever, for this condition and others, they never tell you, like, go to the National MS Society. I mean, things you would expect. So you're left to be maybe on a Facebook group and someone says, well, newly diagnosed, you need to join all these organizations. I like the doctors' clinics that have an approach where there's a nurse, a very experienced nurse that I can more easily access. Sometimes I just can't reach the hematologist because they also are doing cancer patients. That's the majority. There seems to be more of their time is spent with cancer patients. So I feel sometimes left out. That's the ones I'm going to put for now.
Okay, thank you. So thinking back to some of those other ones, like around women's health or one of your experiences, what else?
I would like to add there should be some app to remind you the doctor visit and the medicine reminder, because with the family job and lot of, you are struggling with a lot of things, so you sometimes forget taking the medicine, or sometimes you forget to go to the doctor's office. So I want some app to remind you, or you have a doctor visit, or you have to take it just pop up on your phone, some app to help the ITP patient. So that's
I realize I have 2 4s, so number 5. This is late at night. All right, what else?
Say financial support or assistance for patients, especially when you're trying some of these drugs that are more expensive. And also mental health support, because I think one of those things that, like, sometimes you just, when you fail a treatment, definitely could connect on that, Julie. Like, when I failed treatments, it was a real gut punch, like, and you just are, and people want to give you the boot, oh, I'm so sorry, things will get better, and it's like, I don't want to hear that from you because you're not in my position, and I'm scared, and I need reassurance from somebody who knows, or from a professional who can tell me, like, ground me and say, relax, breathe, think through, what did your doctor say, what are your next steps, and then go. And I'd say that's kind of and really the medical stuff, like the access to journals and things, that tacks on to, like, women's health and pregnancy and stuff, because if I can bring paper copies with me to these doctors, they can't tell me, oh, well, maybe there'll be research. It's like, oh, no, here it is for you, right in front of you. You can read it later. And then when I come back for my next visit, we'll talk.
Building on the financial support, overall, I've seen more of these pharmacy lines where you have sometimes 24-hour access, sometimes more limited, where you can contact a registered nurse for the pharmaceutical and ask specific questions, or as specific as they're willing to answer. And with rituximab, I was on it for a different condition before I knew I had ITP, and they have a Genentech, the Care Foundation, and they have another foundation that are really, really helpful. My insurance denied it initially as it's experimental and not medically necessary. And, it was just very interesting that they had a report, sample letters to file. They took the doctors through step by step how to get something approved, and all that kind of circle. If I don't need the nurses because I know everything, fine. But I like that approach of having people that we can access and talk to that we don't have to pay for, separately. Like a coach, somebody trying to market their services as an ITP coach. They're going to help me deal with my illness for $150 an hour.
Okay. Because I've gone over time, unless there's something like really top of mind as far as something else to go on the wish list, the last question that I have for you guys is, what would you not want at these times? Like, what do you not want?
Everybody deciding what I should do except me.
Okay.
Which can sometimes be the doctor and sometimes could be a family member. I root on this one. Like, what? This isn't
like
your body. They want to be helpful.
I second that. I don't want pity from people or decision-making from everybody else. It's just like, just give me the tools to make the best decision for my own care.
Anything else?
Just the tools. Right. That tools word is a big word. Have appropriate tools is the way. To have.
Pop that in here. So when you say appropriate tools, anything other than what we've already listed?
No, I think this is pretty good. This really grabs onto all the major themes through the patient journey.
All right, perfect. Well, with that, thank you, ladies. I so appreciate you taking time out with me. I've sat here and I have like this big old storm cloud hanging. I'm like, it's not even late. I'm like, what is going on here? So I'm sweating like, oh gosh, what's about to happen? So thank you, ladies, for being here and keeping me distracted from wondering if I'm about to be in a tornado. You guys are awesome. Have a wonderful rest of your evening.
Thank you.
Thanks.
Thank you.
Thank you. Bye.